Welcome and Happy New Year. My name is Mary Lynn Carver, and I'm glad you're joining us for the final session in our Type 1 Diabetes Screening Series, a program designed to help families and individuals understand the process, emotions, and next steps that follow screening for Type 1 diabetes. Today's session is titled Living in Limbo, Navigating Life in the Early Stages of Type 1 Diabetes. Living in the early stages of type 1 diabetes before full diagnosis can feel like being stuck in limbo. There's uncertainty, waiting, and a constant sense of the in between. So, today we're going to focus on what it is like to cope within this emotional and psychological space of early stage type 1 diabetes. At Diabetes Sisters, our mission is to support and empower women living with and at risk for all types of diabetes through education, resources, and community. In that spirit, our conversation today will explore practical tools for managing uncertainty, processing emotions, and building supportive routines while navigating stage one or sorry, I just lost it. Sorry. Stage one or stage two type 1 diabetes. We're honored to be joined by Dr. Victoria Buhari, who you may recognize from earlier sessions in this series. Dr. Buhari is board certified in endocrinology, diabetes, and metabolism, as well as lifestyle and obesity medicine. She's the founder and CEO of Perry's Wellness and Diabetes Center, and her expertise connects medical knowledge with real-world strategies that empower patients to take meaningful steps towards better health. We're also happy to welcome back Dr. Jude Johnson, a licensed psychologist specializing in behavioral health, coping strategies, and chronic illness management. Dr. Johnson will share insights on the emotional impact of the early stages of type 1 diabetes. We're also joined by Tia Ware, a woman living with type 1 diabetes, who will share her lived experience during our breakout session shortly. Tia will speak about her journey through the screening process and navigating the early stages of type 1. Before we begin, a few quick housekeeping notes. You're welcome to use the Q&A box throughout the first half of the presentation. Our speakers will address as many questions as possible during the second half of the event. After the main discussion, we'll move into a breakout room for a live Q&A. This will be your chance to speak directly with our speakers, ask questions, and connect with others in a smaller, more personal setting. Thank you again for joining us. It's now my pleasure to turn things over to Dr. Buhari, who will start us off with an overview of the type 1 diabetes screening process.
All right. Well, thank you so much for that introduction. Very, very excited about this topic. It's definitely one that is very important and one that both the community and providers need to know more about as we continue to know more about it. All right. So, what is type 1 diabetes? It is an autoimmune condition in which antibodies are formed as a result of destruction of certain cells within the pancreas. These cells are called the beta cells, and these particular cells produce what's called insulin. Insulin is important because it regulates the amount of sugar within the bloodstream. And this is important because if you have too much blood sugar in the bloodstream, that can lead to serious conditions such as diabetic ketoacidosis, which can be life-threatening. If you think about the daily demands of living with type 1 diabetes, it can be a struggle. You have the need for constant monitoring. You need a team, people that you trust, be it your healthcare providers, support systems. How do you exercise? And how much insulin should you take before exercise? What type of meals should you take in before you exercise? Insulin use, and then what type of insulin are approved by your insurance? What type of insulin do you want to use? Be it the multitudes of different type of insulin that's currently within the system. So again, all these decisions, emotional struggles. We know that living with diabetes, there's a higher rate of what we call diabetes distress, as well as depression. And then around your meals, unfortunately, with with diabetes, it's not one size fits all. You do have one thing that would increase one person's blood sugar very high, and someone else may not have that same response. We do know that the risk of developing type 1 can be related to family history, and that can be up to even 30% higher risk if you have both parents who have type 1, all the way down to 1% if it's just a mother with type 1. So there is a higher risk if you do have a family history of type 1 diabetes. But it's important to know that 85% of people actually do not have a family history. So majority of people are unaware or not even thinking about type 1 diabetes when the diagnosis is made. And I mentioned about diabetic ketoacidosis, which is life-threatening and is due to a high amount of blood sugar in the bloodstream. We have 40% of people who are diagnosed with diabetic ketoacidosis at the time of diagnosis of type 1 diabetes. Historically, we tend to know a diagnosis of diabetes at that now what we call stage 3. That is, your blood sugars are high, you're urinating a lot, you're very thirsty. So you have the clinical signs of diabetes. You also have a high level of blood, your blood sugar level is also very high. So that's your typical stage 3. But what we know is that the onset of type 1 diabetes actually begins before even your blood sugars rise or even before you have symptoms. And now we've classified type 1 into 3 different stages where all of the stages have at least two of those antibodies that I mentioned at the very beginning. In stage 1, you don't have any changes or any abnormalities in your blood sugar levels, so you don't really have any symptoms. In stage 2, that's when your blood sugar levels begin to rise mildly, not to the level of stage 3, but there is a mild and abnormal elevation of the blood sugar levels. So the question becomes, why should we test for type 1 and what is the purpose? Number one, we really do want to reduce the risk of diabetic ketoacidosis. As I mentioned, it's life-threatening. If we test and you're found to be in either stage 1 or in stage 2, then we know that we can prepare you, give you knowledge, so that we can prevent complications, be it very, very high blood sugar levels, or even giving you the tools when you start insulin to prevent the lows. And also the ability to have access to clinical studies in addition to early treatment. And when it comes to how do you screen, I mentioned the antibodies. So there are 4 different antibodies that's currently being recommended by the American Diabetes Association. And these antibodies are simple blood tests that you can get done. And there are various ways in which you can get those done. And this is not an all inclusive list. This is just a few options where you can have, there are some research-based screening programs. The Ask as well as TrialNet are research-based. You can get screened for free, so there's no fee attached to that. There's some state-based screening programs, so it can be as early as newborns, but they can take the newborn blood and test that. So that's the Cascade and Pledge. And then you can go get tested through your typical lab where your healthcare provider will put in an order. You can go to LabCorp, you can go to Quest, etc. Or even get a kit that you take home or do at your healthcare provider's office called Enable Biosciences. So there are multiple ways in which you can get tested for type 1 diabetes. What is very exciting is the fact that there is a new medication called Teplizumab. And this medication was approved in 2022 for those who are in stage 2 greater than 8 years old who have been tested for type 1 diabetes. So it's very exciting because it really does delay the onset of stage 3 by what we now have been shown to be a median or average of 2 years. So the medication is delivered over 14 days. Daily infusion over 14 days. And again, really does help to prevent the onset of the clinical form, which is stage 3 type 1 diabetes. I'm going to turn it over to Jude, who will talk about some of the things we see when it comes to screening for type 1 diabetes, sometimes the emotions that we feel. Thank you, Jude.
Thank you, Dr. Bahari. I appreciate everything that you shared. Great information. And Mary, thank you for the kind introduction. Fear is a natural part of being a human being. It is a protective mechanism to keep you safe. And so when we're asking what if questions about type 1 diabetes, that can cause some fear. Anytime we have uncertainty about the future, that can cause anxiety or worry about how I'm going to handle this. So people may ask the question, what if I test and it's positive? What's that really going to mean for my family? You may be thinking, I already have so many things to keep up in my everyday life. If this is positive, what does that mean? I don't know if I'm going to be able to keep up with the testing and all of this. But knowledge is power. And as Dr. Bahari pointed out, that DKA is reduced from 40% to 5% when that test is done. So we move from uncertainty to truly understanding what's going on, and knowledge really is power, so we can take action. Which, if we're able to take action, that's going to mean that we can plan, we can have fewer crisis events. We don't want to end up in the emergency room or not being able to get the care that we need suddenly because there is an event that is medically dangerous, right? So knowing can help us prevent that. And so, what can be helpful is to try to reframe the fear, which is based on how we're thinking about this. So, instead of asking, what if we test, like, oh no, we can say, what if we don't test? What if we don't discover what's really going on here? Because if we don't discover it, then we might end up in an emergency situation versus knowing what's happening, being able to monitor blood sugar levels, understanding how to intervene when it's necessary. So when we face the unknown, it is scary, and that's a natural part, but this helps us gain clarity and confidence and gives us more choices about our own health and well-being and taking care of ourselves and our loved ones. Next slide, please. And so when we're feeling afraid, when we're feeling uncertain about the future, there are some mindfulness strategies that you can use to help ground you into the present moment. And, the uncertainty, the what ifs are pulling you into the future. And that can cause us to get worried, fearful, cause us to maybe even freeze sometimes. And often in these situations where there's uncertainty, your mind is going to go to the future. What if this? What if that? Oh my gosh. Heart rate begins to rise, blood pressure begins to rise, muscles become tense. You start telling yourself a story about what's happening. And sometimes people even get to the point of getting, panicky. And so, what you can do when your mind is running into the future like that is to pause and do this grounding strategy of 5, 4, 3, 2, 1. And so it's five things that you can see around you. So wherever you are right now, you can just name five things out loud or to yourself, whatever you wish, and that brings you into this moment. So I could say monitor, water bottle, pen, book, microphone. Four things that I can feel, that I can touch. So in your environment, you might notice something hard, something soft, something smooth. Really be present with touch. You know, three things that you can hear. Maybe the sound of my voice, maybe sounds within the room. Maybe you can hear the fan, or you can hear, some sounds coming from outside of your room or even outdoors. Just listening closely brings us right into this moment. Two things that you can smell. and one thing that you can taste. So having, maybe some Altoids around, some peppermint, something that can bring you into this moment that you can smell and that you can taste. Now, you don't have to use all five senses to ground yourself in the present moment, but it certainly can't hurt. You may find that there's one particular sense that really brings you into the moment. So, whatever that is, feel free to do that. Sometimes people find it helpful to hold an ice cube for a little while, but it's pretty cold out, so you might not want to be holding ice cubes, but that really does help some people. So, if you're cold averse, you could just run your hands underneath some nice warm water, and that might be calming or bring you into the moment. Now, that's grounding. You can use that several times a day or whenever you find it to be helpful. Your senses, your five senses are like doorways into the present moment. Our mind, thinking about the future or the past, are like doorways into the perception of what may happen. So grounding's coming into the here and now. Mindfulness, which is what we're going to talk about next, the skill of stop. Mindfulness is being present in the moment without judging it negatively or even positively, but just actually trying to see the moment as it is clearly. And one of the ways we can do this is to stop, to pause, to interrupt the train of thoughts that are going on in our mind about the what if scenarios or about even things that may have happened in the past, and to invite ourselves to just notice what's happening in this moment by taking some deep conscious breaths. And you can even take a couple of these on your own if you wish. Nice big deep breath in and act like you're blowing through a straw on the way out so that your exhalation is twice as long as your inhalation. And this deep breath in actually sends a message to your body and mind that you're safe. And the nice slow breath out lowers heart rate and blood pressure and actually then begins to regulate your nervous system enough so that you can move on to the next step with which is observation. What are you observing? Well, you're going to observe your body and how it feels. You're going to observe any emotions, which are, of course, are experienced in your body. And you may even observe thoughts that you're having, but you're attempting to be a witness, to be an observer to these thoughts, sensations, and emotions that are happening moment to moment. So when you get into a fight, flight, freeze, a nervous system activation, um, that feels like we've just been dumped into a rushing river and that we can't gain our footing or our stability right away. But when we stop, when we pause, you can get your head out of the water and figure out where you are. When you start taking those deep breaths, it's you get closer to the ground. When you get out of the water, you can begin to observe and witness what's going on inside of you. And, you might observe by naming or acknowledging what's happening. So you might even just say, feeling a fear, thought about the future. You name and acknowledge, put labels on what is happening moment to moment. And there's a really good reason for this, is that you are engaging the frontal lobe. When you get into fight, flight, or freeze, this part of the brain often has less blood flow, making it more difficult for you to think clearly and problem solve. So, when we're in fight, flight, or freeze, it's like we feel like that we need to like force our way out and like, I got to figure it out now. But yet, if you just trust your system a little bit to stop and breathe and observe and be present, that often is going to give you the most important valuable resource, which is awareness and clarity. And so when we can be aware and we can see things more clearly, then we can take wise action. So the wisdom is already within you. It's just about accessing that regulation. So that practice, that mindfulness practice of stopping, breathing, observing, and being present. The last one is, you know, I can just be present with the next moment. So if you're washing the dishes, just wash the dishes. If you're sending an email, just send the email. Be fully present in that activity of the moment. And that can be very calming and reassuring to us. The next one is the mindful reframe, shifting from what if it's a positive test? What if I don't know what to do? What if I freak out? Any what if questions that we're asking. With mindfulness, we can shift that to what do I need to do right now? And so, if we've been able to ground ourselves and regulate ourselves, then we can really ask that question, okay, what now? Brings you right into the moment. Now, sometimes we may not be able to figure out what to do in that moment. So, the tendency sometimes when we don't know what to do or we feel overwhelmed is to become self-critical, which is a natural part of being a human being, is that we are hard on ourselves sometimes, much harder than even other people would be on us, which is why it's so helpful and important to develop and grow the skill of having compassion and understanding for yourself. And, this is not just an airy-fairy idea of like, oh, just love yourself and everything will be better. There's actually great evidence and research to show that developing compassion and understanding for yourself actually will help you take better care of yourself and give you more inner resources to care for those around you. It's this whole idea of that if you're on a plane and you're flying and the oxygen mask comes out, you don't give it to your child and your loved ones around you first. You give it to yourself so that you can take care of others. So don't think of it as a selfish act. It's actually a very kind and compassionate thing to do for yourself and other people. And there are three components to self-compassion, which one is just being more kind and friendly to yourself, talking to yourself just like you would a dear friend. And often, and I do the same thing, is that when I mess up, I might be critical on myself, but there's always an opportunity to make a U-turn. I can then take a step back and breathe and observe and say, okay, how would I say this to a friend? Can I say that way back to myself? And we can get into more of a habit of talking in a more friendly, kind way to ourselves. The second component of self-compassion is understanding that you are not alone in this. When we're overwhelmed and stressed, we might think it's only happening to me, but there is shared humanity. There's a lot of people suffering from diabetes as well as other challenges or stressors, so that when you think that you're alone, you might just remind yourself, you know what? There are other people out here experiencing things similar to me, and I'm not alone. And the last is mindfulness, that is actually part of having compassion and understanding for yourself, is to practice this nervous system regulation of soothing yourself and regulating your emotions so that you can move forward. Next slide, please. And so that goes right along with that. You're really not alone. So if you're having trouble with self-compassion or remembering that you're not alone, there are organizations like Diabetes Sisters that can be here to help support. You know, there is your community, healthcare providers like Dr. Buhari. There's mental health resources out there so that you can talk about what's going on if this is emotionally taxing. I think that going to talk to somebody about how you feel is very important and valued. And of course, I'm a little biased here as a therapist that talking to someone can have its advantages, but it really can, because one of the things that we know about emotion is that we only have about 6, 7 words for most people. Well, I didn't mean to make that reference for all these teenagers out there, but uh, that that's what we know, right? Anger, fear, sadness, but there are a large amount of words that can be used to describe how we're feeling. And the more granular, the more detailed we can become in describing our own emotions, the better we can understand them. And understanding our emotions gives us more clarity and more ease. Journaling can be helpful. Talking to a friend if you're not ready for therapy is okay too. Just getting the emotions out and up is really important. So fear, Again, natural human emotion. We can embrace the fear and move towards the fear so that it doesn't have to lead the way. Because when we move towards the fear, the thing that we're afraid of actually becomes smaller. When we run from it, it gets bigger. And we may need support moving toward it, right? You're not alone. You don't have to do this alone. So if you need support moving towards something that is challenging or fearful, ask for that support. It's brave to do so. It's vulnerable to do so. But we can't actually be courageous unless we are vulnerable. I know it's a paradox, right? Of being open and vulnerable about how I feel takes courage. When we are vulnerable, often we feel weak. We kind of want to hide. But when we watch other people be vulnerable about something that's going on with them, we often see them as having confidence and courage to stand up. So, something important to remember that, your knowledge and understanding will build your confidence, and your compassion will help you strengthen your resilience. So, I really appreciate the time to talk about mindfulness and ways that we can connect to ourselves, our others, and communities because we're all in this together. And I appreciate the time, and I will turn it back over now to Dr. Bahari.
Thank you so much. Your tips and pearls are just wonderful and definitely invaluable. I always feel like I learn more and more from listening to you, Jude. So, for more information when it comes to screening for type 1, please visit diabetessisters.org. There's a vast amount of resources and information available at the site from webinars that have been recorded. There's a series called T1D Screening Streamlined. And then you'll see other resources, some downloadable files that you can print. Some you can send to your healthcare provider if they have questions. So a multitude of resources available here.